Yeah, so this project is really geared towards is the underpinning of this project is explainable AI. So when we in the future when we use so what we've delivered with these models is outputs for each patient with a given set of parameters to explain why they would be to the physician and the patient why they would be at increased risk or not from of lymphedema with their given treatment parameters and the treatment they've already had when they're about to have radiotherapy, and why then that will hopefully then explain why they might be wanting to have an extra intervention such as wearing the arm sleeve to prevent this. So it's really the way that we see AI is to support clinical decision making, but not to take over clinical decision making, which is also largely based around and using AI rather than using it as a black box, using AI as in this case to inform the patient and the physician of predictions that it makes, and then helping them make a decision. But this is all being very transparent and explainable, rather than being not understandable. Because when these decisions are made about healthcare and cancer treatment, obviously the patient and the physicians will want to have trust in these algorithms.